First question is, what is the functional unit of the kidney? Options are nephron, glomerulus, loop of Henle, renal pelvis. What is nephron? Nephron is the structural and functional unit of the kidney that is responsible for filtration, reabsorption, secretion and excretion. Then what is glomerulus? Glomerulus is the network of capillaries within the nephron where blood filtration occurs. Then loop of Henle, it is a part of the nephron that concentrates urine by reabsorbing water and salts. Then renal pelvis, it is the funnel shaped structure within the kidney that collects urine and diverts it towards the ureter. Hence, by this description, it is clear that nephron is the functional unit of the kidney. Next question is, which part of the nephron is primarily responsible for filtration of blood? Options are proximal convoluted tubule, Bowman's capsule, loop of Henle, distal convoluted tubule. I told first option, that is proximal convoluted tubule. What is this? This is the segment of the nephron where most reabsorption of water, ions and nutrients takes place. Then Bowman's capsule, it is a cup-like structure surrounding the glomerulus that collects the filtrate during filtration. That collects the filtrate during blood filtration. Then loop of Henle, just now I told, it is a part of nephron that concentrates urine by reabsorbing water and salts. Then distal convoluted tubule, it is a part of the nephron that is involved in the selective reabsorption and secretion of ions to regulate water and electrolyte balance. Hence, here the correct answer is Bowman's capsule. Bowman's capsule is primarily responsible for filtration of blood. Next question is, which hormone regulates water reabsorption in the kidneys? Options are insulin, aldosterone, antidiuretic hormone, then cortisol. What is insulin? Insulin is the hormone that regulates blood glucose levels but does not directly affect water reabsorption in the kidneys. Then aldosterone, it is also a hormone that promotes sodium reabsorption and potassium excretion, indirectly influencing water retention. Then ADH, that is antidiuretic hormone. It is also a hormone that directly increases water reabsorption in the kidneys by making the collecting ducts more permeable to water. Here I told antidiuretic hormone. Then cortisol, it is a stress hormone that affects metabolism and immune response but has limited direct effects on water reabsorption. Hence, the hormone ADH, that is antidiuretic hormone, is responsible for regulation of water reabsorption in the kidneys. Next question is, the primary function of the loop of Henle is filtration, reabsorption of water and sodium, secretion of potassium, excretion of waste. Filtration. The process of blood filtration occurs in the glomerulus, not in the loop of Henle. Then reabsorption of water and sodium. For this, the loop of Henle is responsible that concentrates urine by reabsorbing water and sodium, helping to maintain electrolyte balance. Then secretion of potassium. Potassium secretion primarily occurs in the distal convoluted tubule and collecting ducts. Then excretion of waste. Waste secretion is the overall function of the kidneys, but the loop of Henle specifically focuses on reabsorption and concentration of urine. Excretion of waste is carried out by kidneys. Hence, the correct answer is reabsorption of water and sodium. Next question is, which of the following is the most common cause of urinary tract infections, that is UTIs? Options are Staphylococcus aureus, Escherichia coli, Pseudomonas aeruginosa, Streptococcus pyogenes. Streptococcus aureus, it is a bacteria commonly associated with skin infections and rarely causes urinary tract infections. Then Escherichia coli, that is E. coli. It is also a bacteria normally found in the intestines. It is the most common cause of urinary tract infections due to contamination of the urinary tract. Then Pseudomonas aeruginosa is also a bacteria that causes urinary tract infections in hospitalized or immunocompromised patients, but it is not the most common cause. Then Streptococcus pyogenes, these are also bacteria primarily responsible for throat and skin infections not commonly associated with urinary tract infections. Hence, here the correct answer is E. coli, that is the responsible for urinary tract infections that causes most commonly urinary tract infections. Next question is, what is the medical term for painful urination? Options are polyuria, dysuria, hematuria, anuria. Here the words itself says their meanings. That is, polyuria refers to excessive production. Poly refers to many or more. Polyuria refers to excessive production or passage of urine more commonly seen in diabetic patients. Then dysuria, this means difficulty, that is painful or difficult urination usually seen in or usually associated with urinary tract infections. Then hematuria, heme refers to blood. Here hematuria refers to the presence of blood in urine which can indicate infection, trauma or other urine issues or urinary issues. Then anuria refers to absence of urine output or very low production of urine. It is a sign of severe kidney dysfunction. Here the correct answer is dysuria, that is medical term used for painful urination. Which condition is characterized by the presence of protein in urine? Options are glycosuria, proteinuria, hematuria, pyuria. Here glycosuria refers to presence of glucose in urine. It is commonly seen in uncontrolled diabetes. Then proteinuria, it is the presence of protein in urine, often indicates kidney damage or kidney disease. Then hematuria, that is the presence of blood in urine, which may indicate infection or trauma, or sometimes kidney stones. Then pyuria, the presence of pus or white blood cells in urine, typically a sign of infection. Here, the correct answer is proteinuria, that is presence of protein in urine. Next question is, which of the following is a sign of acute kidney injury? Options are decreased blood urea nitrogen levels, oliguria or anuria, hypokalemia, increased urine output. Decreased blood urea nitrogen levels, that is BUN levels. Acute kidney injury typically causes elevated BUN levels due to reduced kidney function. Oliguria or anuria, it is the hallmark sign of acute kidney injury, characterized by reduced urine output or complete absence of urine production. In hypokalemia, acute kidney injury is more commonly associated with hyperkalemia, that is elevated levels of potassium, not hypokalemia. Then increased urine output is not typically seen in AKI. Instead, urine output here decreases. Hence, here the correct answer is oliguria or anuria.